help you understand why inflammation can be connected as a causal link to so many diseases. And the reason for that, if you're only staying for the first minute, is the reason for that is inflammation is the lowest common denominator needed to cause or manifest a chronic disease. And the reason for that is it will find your weakest link. And then in a group of people, the reason that 10 people that are chronically inflamed don't all manifest the same disease is because those 10 people have 10 different weakest links. So inflammation in general can cause chronic disease in everyone, but what specific disease in anyone determines or depends on, excuse me, what that person's weakest link is. So it's pretty cool. And I have a paper today that shows it to you in a nice graphic and hopefully will help you to understand it further. So that paper is this one here, published in Cold Spring Harbor Perspectives in Biology in 2014, entitled Interleukin-6 in Inflammation, Immunity, and Disease. And in blue here, you can see that I highlighted interleukin-6, also known as IL-6, promptly and transiently produced in response to infections and tissue injuries, contributes to host defense through stimulation of acute phase responses, hematopoiesis, and immune reactions. So acute phase responses is an inflammatory response. Hematopoiesis is production of blood factors like red blood cells, white blood cells, platelets, and then immune reactions follow the white blood cells. Although its expression is strictly controlled by transcriptional and post-transcriptional mechanisms, so there's genetic control there, dysregulated continual synthesis of IL-6 plays a pathological effect on chronic inflammation and autoimmunity. So a less nerdy way to say that is chronic inflammation will drive autoimmunity and chronic inflammation associated diseases. And you'll see a list of those coming soon. So you may remember from past videos where we've discussed inflammation and chronic pain or inflammation and autoimmunity. I've put this graphic up for you and I'll link to a past video on this here. But on the far left, you see the beginning here where it's not actually the beginning. Actually, the beginning is the genetic part. Okay, so we have genes that encode for these the IL-6, the interleukin-1 beta, the TNF-alpha or tumor necrosis factor alpha. Those things are all called cytokines, which are basically chemical messengers that our cells produce, and they produce them once the genes encode for them. So the step before the IL-6, IL-1 beta, TNF-alpha is the genetic transcription of these to be produced. Once they're produced, these are the matches that start the fire, so to speak. These are the inflammatory messengers. So when those hit the liver, they'll produce a common inflammatory marker that you see on your lab work called C-reactive protein. And C-reactive protein is a surrogate marker for those cytokines. And the higher that is, the more inflamed you are. And so the higher your risk of pain or cardiovascular disease or cancer or autoimmunity or dementia or whatever your weak link is. So in today's video, we're going to specifically be looking at IL-6, but a lot of this stuff is similar for IL-1 beta and TNF-alpha. So you can think about IL-6 is our representation of inflammation in today's video, but any of these are going to contribute to what we're talking about in a large way. So if we jump back to the paper, this is the graphic that I love from the paper, and because it allows us to take inflammation in general, the general term inflammation, and get specific with it. So it allows us to answer that person's question who said, well, how come 10 people in the room that are chronically inflamed don't all 10 develop the same disease? Well, because the inflammation hits all 10 of them differently, meaning all 10 of them have a different puzzle, and the weakest link in each person's puzzle is different, so that will manifest in a different outcome. And so let's blow this picture up and dive into that further. All right, so let me get my magic pen out here and we will get nerdy. So what we have over here is we have a cell, we have called an immune cell here, producing interleukin 6. So these red circles are the interleukin 6 being released by the cell out into the system. And remember, interleukin 6 is a cytokine, which when it binds to or lands on, you could imagine it landing on other cells, it's going to influence that cell's physiology in some way. Okay, so this immune cell releases interleukin 6, and if that interleukin 6 heads up here and hits a hepatocyte, which is a liver cell, okay, that's going to result in production of C-reactive protein, as we saw in the previous slide. And that C-reactive protein goes up, okay? So that's a general increase in inflammation. Well, an increase in C-reactive protein is a known independent risk factor for an increased cardiovascular disease. So high CRP raises cardiovascular disease risk. That could be heart attack, that could be clotting, that could be stroke. So we don't want to have high CRP levels, and remember that high CRP is high inflammation. Well, high interleukin 6 or high inflammation in the liver also promotes increase in fibrinogen. And fibrinogen, again, promotes clotting. That's part of the clotting cascade, so that increases the cardiovascular risk. High inflammation can promote high amyloid, and that can drive amyloidosis, okay, which is another disease. And amyloid might sound familiar to you because beta amyloid is what builds up in dementia and Alzheimer's. And so high inflammation does promote increase in beta amyloid as well. A reduction in albumin is due to an inflammatory response. Albumin is what's called a negative acute phase reactant. So when you're inflamed, albumin will go down. That's the negative part. And when you have a drop in albumin, that can drive edema or swelling, because albumin is protein that helps maintain the osmotic gradient in our body and modulate fluid dynamics. And so if we're losing that, we can become more swollen and edematous. Hepcidin increase in the liver due to inflammation can drive anemia of inflammation. Now, when most people hear anemia, they think of an iron deficiency anemia. That is one form of anemia, but there are multiple forms of anemia, and not all anemias are due to iron. Only the iron deficiency one is due to iron. But anemia of inflammation is a reduction in your red blood cells, your hemoglobin, and your hematocrit in the absence of iron, low iron. So you have normal iron, but you still have anemia. That's anemia of inflammation. So your cells are low, not because of a lack of iron, but because you're so inflamed. So that's the liver. If we've got inflammation hitting the bone marrow specifically, that can raise our platelet counts, and that can promote thrombocytosis, which basically is just high platelets, which can be related to clotting risk and other factors. Okay. Interesting here. I love this section because IL-6 hitting immune cells can dictate which way the immune system goes. Okay, it impacts immune cell differentiation. Okay, so you can see right here, we'll look at CD4 T cells. And if I can jump forward a slide here for a minute to an image in my book. Let me see if it'll let me. Keeps the art. Well, yeah, let's do it. Let me just get rid of the drawings. So if we keep differentiation in mind, CD4 T cell differentiation. So inflammation will impact which way our cells, our T cells in our immune system mature. Okay, so this is a graphic from my best-selling book here, The Autoimmune Answer, which can be found on Amazon. It's an audiobook, it's in Kindle, it's in hardcover, it's in paperback. But if you really like this topic and you specifically like the autoimmune part of it or want to learn more about autoimmunity, I highly recommend my own book, which I don't know if I'm allowed to do because that's, of course I would, I'm biased, but check it out. Anyway, this is in the book. And so to understand your immune system, we've got two sides to our immune system. Quickly, we've covered this in other videos, so I won't spend a lot of time, but we've got the innate immune cells, the first responders, okay? They find an antigen or something foreign, and they come handed off here to a naive T cell, and these are all CD4 cells that we're talking about here. So when that dendritic cell hands off the antigen to the naive T cell, think of this naive T cell or this TH0 as a chubby baby. It's cute, it's got wrist lines and ankle lines, but it's useless. It has to mature into an adult in order to be useful. And these are all adults over here, all these other ones, okay? So whether this baby matures into a doctor or a lawyer or a teacher or a carpenter or whatever, that is determined by what you see on these different black arrows or the cytokines that you see. Okay, remember we're talking about interleukin-6, which is an inflammatory cytokine, but there's cytokines that are non-inflammatory. So each of these things on these arrows are cytokines, and so they influence the growth of this baby or the differentiation, what it becomes, into different things. Okay. So we said we're talking about interleukin-6. So where, if we've got a lot of inflammation that's driven by interleukin-6 in the environment, where is that going to drive this baby cell? It's going to drive this baby towards Th17. And as you'll learn in my book, Th17 is the T cell phenotype that drives the tissue damage and autoimmunity. So if you have a lot of IL-6 around chronically, that's going to bias you toward a Th17 immune phenotype towards an autoimmune weakest link. Okay. And in so doing, that's also going to inhibit your T regulatory cells, which are the anti-inflammatory T cells or the anti-inflammatory CD4 cells. So it's a double negative for you. Okay. So if we keep that in mind here and head back to the previous slide, we can go to look at this again, and we say, all right, we've got an IL-6 cytokine that's influencing the immune system, and specifically right now we're talking about CD4 T cells. We just saw in the picture from my book, IL-6 will drive a naive T cell down a Th17 differentiation, and when the Th17 goes up, that increases autoimmune risk and associated chronic inflammation with the autoimmunity. And we saw at the same time when IL-6 hits a CD4 T cell, while it is driving Th17 differentiation, it is also inhibiting Treg differentiation. So remember on that paper, the Tregs were the anti-inflammatory CD4 T cells for us. So if we block anti-inflammatory, that is a net pro-inflammatory action, right? A negative of a negative is a positive. So you block the negative, you block the anti-inflammatory, and you end up with a pro-inflammatory outcome. So chronic inflammation is going to bias your immune system towards an autoimmune outcome. And autoimmunity is when your immune system shoots at self. And which part of you is it going to shoot at? Well, that's different for each person. So in one person, it might be Hashimoto's disease, thyroid, it might be rheumatoid arthritis, joint, it might be pandas, brain. So it just depends on the person and what's going on. If we have high IL-6 levels and we're hitting CD8 T cells, okay, then we have increased cytotoxic T cell differentiation. And these are different from the CD4 conversation we had. These are killer T cells. And so again, if they're imbalanced, that can lead to self-tissue damage, chronic inflammation, poor outcomes when they're inappropriately high. IL-6 impacting the antibody component of our immune system, or B cells, okay? High IL-6 drives up antibody production. And so now You may have autoantibodies, which are part of the autoimmune picture, because now you've got antibodies against self. Okay, and if antibodies recognize self as enemy, again, that's going to be autoimmune self tissue damage, attacking of self. We don't want that. And hypergammaglobulinemia is another thing that can happen, which the gamma globulins are your IgGs, your IgAs, your IgMs. If you have too many of those, again, there's more potential for adverse reactions and tagging of self. We don't want to attack ourselves. Now, let's change tissues. Now the IL-6 is going into synovial tissues. Synovial tissues are joint tissues, okay? And bone, so connective tissue. So too much inflammation, we've talked about in the past, and I can link to the video here, that once you are postmenopausal, okay, postmenopause, osteoporosis is not a calcium issue, it is an inflammation issue. Okay. So the reason I say this is because if you're postmenopausal and you go to your doctor and they do a bone scan and you've got osteopenia or osteoporosis, they're going to say, take a calcium magnesium supplement and let's test you again in next year, a couple of years. Okay. But the problem when you're postmenopausal is not a lack of calcium, it's you're too inflamed. Why? Well, because as we age, there's this concept called inflammaging. Okay, it's a combination of inflammation and aging. All right. So inflammaging, and as we age, we lose the Th1 immune response, which is beyond the scope of this video, but we've talked about it before. But as that goes downhill, we have an increase in inflammation, and the inflammation will increase macrophage production. And in bones, you have osteoclasts. Clasts. And what you see here, osteoclasts and osteoblasts. So clast is C, clast, and B, blast. You can think blast for building bone, and clasts is the eating bone. Okay, well, if we have increased inflammation here, you can see it increases osteoclast formation. So you have bone-specific macrophages, our osteoclasts, they're going to eat your bone. And eating the bone away drives osteopenia, osteoporosis. It's not because you're lacking calcium. It's because you have an imbalance between your clasts and your blasts, with the clasts winning. So you're eating faster than you're building. That leads to a net loss. Okay, so you can help prevent that and slow that by not being inflamed. So you want to have normal IL-6 levels. You want to have no additional inflammation beyond the physiologic aging that occurs. Okay. If we have increased VEGF due to inflammation, that's vascular endothelial growth factor. That's increasing, and angiogenesis is similar. That's increasing blood vessel growth. That's increasing permeability of the blood vessels. So you know, if you've heard of leaky gut, you could picture it as leaky vessels. And so, you know, you're losing fluid component from the blood out through the vessels into the tissue. And so you can have joint swelling and edema again, right? So edema is swelling, buildup of fluid. So you get swollen joints, painful joints. You know, if it happens in the lungs, you could have issues with breathing. You could have fluid on the lungs. You know, we don't want fluid outside where it should be. And then lastly, if we drive inflammation in the skin, okay, we can increase collagen production, and now you have fibrotic tissue buildup. Things like a keloid scar. If you excuse me, think about college guys who join a fraternity and they brand themselves. The brand on their arm is this huge keloid scar, that big bubbly raised scar. That's a keloid, that's fibrotic tissue. So if you are producing too much inflammation in the skin, driving increased collagen can lead to fibrosis and keloid production. And so you may say, sustain a wound that in your friend healed normally and they have a tiny scar or no evidence of it after a time, and in you develop this big keloid. That's an abnormal healing of that wound. So I hope this image helps your mind understand how inflammation, just general inflammation, can become specific depending on you and what your weak link is. So we all, in order to go to chronic disease and disability and ultimately death, inflammation is the lowest common denominator there. We're not going to develop chronic disease without inflammation, but which chronic disease specifically we each develop is unique to each of us in our weak link. Okay. So I think this is a great image to help us get there, and hopefully you're able to see that with me. If you like the conversation, especially regarding the immune system component and the autoimmune tie-in, then again, I would point you to Amazon to check out my book where I have this image and I talk about it much more in depth as it relates to autoimmune disease, and the interplay of your environment and your diet and your stress levels and all of that stuff. So if that's something you're interested in, check that out on Amazon. Otherwise, the main take home is we want to avoid chronic inflammation at all costs. And to do that, you have to live as healthy a lifestyle as possible. And that's where a functional medicine practitioner can join you on your team and help you achieve that goal.